everyone, and welcome back to my channel. Apologies, I haven't been able to do videos for quite some time because struggling with my mental health, with OCD. It makes everything very slow. You know, everything takes a very long time. I've only just got out of my pyjamas and it's just got 12 o'clock, so everything takes a very long time at the moment, so I just don't really have the time to do lots of videos at the moment. But I wanted to do a video today because yesterday, Thursday, I had an initial assessment meeting from the Assessment and Treatment Service. Now, I was under the impression that I would be actually starting therapy yesterday. I thought it was going to be my first therapy session. That was my impression. Turned out I was way off the mark, and it was actually a triage appointment. And I only actually registered that towards the very end of the meeting. And this meeting went on for a really long time. I can't remember exactly how long, easily over 2 hours. It seemed to, I didn't time it, I think it was in a range of, anyway. It was a really long meeting, way longer than I thought it would be. I thought it would just be within an hour. And it was with an occupational therapist, and when I found out I was seeing an occupational therapist, I was thinking, well, that's a bit strange, because I thought that for OCD therapy I would be seeing a psychologist, like a clinical psychologist. So that didn't really sit very comfortably with me. Occupational therapists, I suppose in theory can administer therapy, but psychological therapy, but their realm of specialism is more functional skills, isn't it? Daily living skills, that sort of thing, hence the name, occupational therapy. So I kind of thought I was being short-changed a bit, because I have very complex mental health problems, very severe anxiety disorder, which has got a lot worse in the last 6 months, and is very disabling, as you know, because I've talked about it a lot. I can't really do much at all. I'm rooted to the house other than my walk. When I do get out, it's very stressful, and I can only go for a very short walk around the same area, and you know all that. I avoid people, and it's very tiring and stressful, and my life is not, it's very limited. Particularly since the pandemic has begun, it's got a lot worse. It used to be, before the pandemic, I was doing fairly well. I was still very limited, but relative to now, I was doing pretty good for myself, and then this happened. So yes, so now it's very bad and very complex, and obviously also being autistic makes it even more complex, and a lot of it is connected to my autism as well. It's all wrapped up. So I thought I needed to see someone very specialist, ideally someone trained in both OCD, anxiety disorders, and autism. And I felt that person should be a clinical psychologist. So I felt rather short-changed to be given an occupational therapist, but then I thought, well, maybe this is as good as it gets. I don't want to make, I got this far, so I thought, if I made a fuss about it, I might end up with nothing, so just best to accept it, sort of thing. But it turned out that it wasn't actually the beginning of therapy anyway, so I got that completely wrong. I often get things wrong in life. I think it's probably partly being autistic, but I don't know. But I do tend to get things wrong a lot. I often get the wrong end of a stick. I don't know. I'm often a bit out of the loop. They did send me some leaflets, but I didn't read them. Probably I should have done, but I find it very hard to read things I'm not interested in. Again, being autistic, I have tunnel vision, and also with all my anxieties, I just don't have the energy. So I probably should have read it, and that probably, if I'd read it, I would probably have understood more what was going on. But yeah, I was under the illusion that it was the first day of therapy, and it only became apparent to me that this wasn't therapy and that this was a triage appointment. Triage, by the way, basically means in healthcare settings, mental health and other healthcare settings, triage is to do with the way they assess. It's like an initial assessment to work out what your needs are, and then they go away and sort of discuss it, and then they allocate you to the service they feel is most suitable. So this was a mental health triage, so it's basically a gatekeeping assessment to find out what your needs are, and then they refer you on, basically. But it didn't click that that was what it was until the end of the assessment. And it did feel rather strange getting an occupational therapist, of all people, was doing the assessment when I specifically came to the service with mental health needs. It's like, yeah, I do have functional needs as well, like or daily living challenges associated with autism, but I've already had an assessment for that with social services. This is specifically for my mental health needs, so it felt rather strange that I was speaking to an occupational therapist, of all people. Like, why not a psychologist? So yeah, so the assessment was really, really long, and I was asked a lot of questions, and it felt very, very invasive. It felt like a rehashing of the social services assessment I'd already had earlier in the year, where I had to talk about my life. It's like, here we go again. Why do I constantly have to tell them over and over and over again about my life story, like constantly rehashing the same old story? It's so exhausting and it's so absurd. It's like, surely they have this on file already. Like, I've been in the system for years. I've got an autism diagnosis. It's all there in my files. All they have to do is go and read my files. Why do they need to ask me all these questions over and over and over again? It's just such a pointless waste of time. Aside from the fact that a lot of the questions weren't even relevant to my current predicament. For example, I was asked when I learned how to talk and when I learned how to walk, like early milestones. Why? What in living hell do those early milestones, what bearing do those early milestones have on my current needs? Like, honestly, it makes no difference whether I spoke at 3 years or whether I spoke at 13 months, for whatever. As it so happens, I learned to speak within the usual time frame, because I have what used to be called, well, the kind of Asperger's type autism, where you speak within the usual time frame. But I mean, so what? What relevance does when I learned how to speak have on me now? My mum, by the way, actually didn't learn to speak till she was 3 years old, and she wasn't autistic, do you know what I mean? But it's completely and utterly irrelevant to, like, how I am right now, you know? Doesn't make sense. I mean, yeah, if they were doing a developmental history, and I've already had an autism diagnosis, again, yeah, if they were doing a developmental history, you'd get asked those questions. But this was for a mental health assessment. So that was strange. Very strange. And then I was asked questions about, like, what qualifications I have, and, like, how I was at school. Again, completely irrelevant. Yes, with mental health, they might want to know how long I've had anxiety for, you know, to know how chronic and complex my condition is. They might want to know that, but then they only have to go and read my files to find that out. Like, I've told, you know, this is something I've already explained. They've got it all on file. They know all my problems. They know that they go right back to primary school. This is all in my files. Why do they need to ask me this again? It seems completely and utterly absurd, and a complete and utter waste of time. Okay, I'm going to move over to video number 2, so I just want to talk about a few things that happened the other day, which really pissed me off. So, moving over to video number 2 now.